Hi, I'm Dr. Susanna Bozzoni, and today we're going to talk about hypertension, that is high blood pressure. Did you know that 84 to 93% of adults after the age of 45 in America are at risk for hypertension or likely to develop hypertension? But did you know that blood pressure naturally goes down with age? It does not go up with age. It is sadly our Western lifestyle that contributes to blood pressure increasing as we age. What does that mean? Well, largely our high stress, our lack of sleep, our lack of exercise, and the food that we eat will drive this unnecessary, modifiable, yes, that is preventable, risk for heart disease. That is our number one killer. So I want to give you some applicable tips. And of course, these are best utilized with a holistic approach, right? So looking at sleep and stress and meaning and purpose and joy and nature and all of those wonderful things that can help lower and improve our cardiovascular risk and our blood pressure. But I'm just going to give you basically a food prescription for high blood pressure. Yeah, my two tops. Number one, ground flax. I always say this, but ground flax is just a powerhouse for so many things, but has been shown to lower blood pressure when you eat it 30 grams a day. That's about 2.5 tablespoons a day. Where can you get it? Well, you can put it in your salad dressing, which is of course what I love to do every morning, and have it with my greens, which is item number 2, right? But you could put it on top of your oatmeal. You could put it in your smoothie. You could use a, quote, flax egg as your binder when you make power cookies that hopefully have no refined sugar but are rather sweetened with whole fruit and have oats and wonderful whole grains in them. Also very useful for cardiovascular disease prevention. But ground flax, 30 grams a day, has been shown to significantly lower blood pressure as much as a low-dose blood pressure medicine. Wow, that's pretty cool. Number 2, dark leafy greens. I would suggest you get at least 4 cups a day and vary them. You know, spinach can be part of these, absolutely, but try to get some of those cruciferous, arugula, some of my favorite. Throw in your wonderful herbs like cilantro. Oh, yes, wonderful. Kale, all of these things. Try to follow the rule. If it's not green, it's obscene. Yes, every time you eat, can you put something green on it? Or maybe at least at lunch and dinner. You know, if you're having a bowl of butternut squash soup, put a handful of arugula on top. If you're having some bean chili, maybe put a side salad, right? Where can you put it? And recognize that you should get to the place where it looks strange if your plate isn't at least a little green. So that falls into the vegetables and fruit category, right? We want to get to 8 to 10 vegetables and fruit servings a day. That will absolutely help lower our blood pressure. That's eating a whole lot of plants, but those are those wonderful phytonutrients that help us fight disease rather than feed it so very, very much. Another easy tip is hibiscus tea. Yes, a quite strong hibiscus tea. So 2 pretty strong cups of hibiscus tea, that's 5 bags in 2 cups, has been shown to lower blood pressure systolic about 5 to 7 points. So drink some nice herbal hibiscus tea that can help you with hydration as well, and it tastes pretty darn good. So those are a couple of tips. What did I miss? Another thing to be aware of. Try not to take anti-inflammatory medication if you can at all avoid it. That's your Advil, your naproxen, your ibuprofen, these things, right? These directly increase your blood pressure, and they also interfere with the function or the ability of some of our most common blood pressure medications like ACE inhibitors or ARB medications. That's your lisinopril and similar medications like that. Well, anti-inflammatory medications will interfere with those working. Not only that, they increase your blood pressure over time and do a lot of other nasty stuff. So limit those as much as you possibly can. Maybe take something like ginger, incorporate turmeric, anti-inflammatory herbs that can lessen your need for that ibuprofen or one of its friends as much as possible. So all of that in combination with regular exercise, stress management, and enjoying nature and sleeping enough, I hope this helps you to lower your blood pressure and get you on that path to your most vibrant self. Thank you so much for your time today, and don't forget to subscribe. Thank you.